Today's ICD-10 quick coding tip focuses on what you need to know about PCS root operation excision. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. ICD-10-PCS defines root operation excision as cutting out or off without replacement a portion of a body part. If only a portion of the body part is removed, then this is coded as an excision. For instance, removing a lump in the breast, removing a single lymph node, or removing a tumor from the lung are all examples of excision procedures. It's not uncommon for physicians to use the term resection to describe procedures that should actually be coded to root operation excision. So when coding procedures, it's important to thoroughly review the entire operative note and not just code from the title of the procedure. The physicians are not required to use the specific terms as defined by PCS when documenting and describing the procedures that they perform. It's the coder's responsibility to be able to interpret the details of the surgery and select the correct root operation. Sometimes it's easy to determine that a portion of the body part was removed, like for example if the physician were to document that they performed a partial resection of the kidney. However, other times it can be more challenging, requiring the coder to carefully review the procedure's description in order to determine what root operation applies. For instance, if the physician's documentation states that the procedure performed was a resection of the sigmoid colon, but the operative report further describes that after removing the sigmoid was then anastomosed, meaning connected to the adjacent intestine, it would not be classified as a resection. This is because if it was a resection, there would be no remaining sigmoid available for the anastomosis to be done. Because the documentation does indicate that there was sigmoid colon left for anastomosis, we know that it was not completely removed and the correct root operation is excision. In some cases, the operative report will describe the subtotal removal of a body part. Subtotal removal is still coded to root operation excision because the complete body part was not removed. The definition of excision is met if even small portions of the body part tissue are left behind. Let's take the example of a patient who undergoes a near-total thyroidectomy, where both the left and the right thyroid lobes are removed, except for a small portion of thyroid tissue is left behind. In this case, the appropriate root operation is excision because the documentation clearly states that a portion of the thyroid was left behind. Biopsy procedures are often coded to the root operation excision. Root operation excision is used when the physician removes tissue using a sharp instrument in order to obtain a sample for testing. To identify excision procedures that have a diagnostic purpose, the qualifier diagnostic is used. So that's it for today's quick tip. I really hope this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.